Hello, my name's Luke Williams, and today I'll be talking about Indigenous health, the contemporary issues associated with that. I'm currently studying a Bachelor of Nursing at the University of Canberra. The following slides are the references that I used to compile this presentation. I'll talk a little bit about Aboriginal culture, the history, the modern day issues surrounding white Australian views of Aboriginal people. We will also look at the social determinants of health and how the social gradient affects this demographic, furthermore exploring how poverty experienced by remote communities affects the health of residents, including children and infants. Touching on history again, I will examine the government policies that were developed to degrade and destroy Aboriginals through motivations of power and greed. Moving also to modern day policies regarding Aboriginals, particularly focusing on the removal of children from families and how that affects the health of those families and indeed the infants themselves. Lastly, I will look at primary health and the initiatives that are working to reduce the gap and analyse why this mistreatment runs deep in Australian culture, a culture that is supposed to be multicultural and embracing. That of the Jewish people during the Second World War. It is vocally apparent that white Australians of the era enslaved, captured, forcibly indoctrinated young, and kept fighting aged Aboriginal males in concentration camps, such as that on Rottnest Island in Western Australia. Have been buried within the complex subtext of society. This is a part of society that is confronting and undoubtedly horrific. An expression of the beauty of Aboriginal culture is exemplified in Aboriginal art, which is riled globally, reaching prices into the millions. As a vivid construct, the truth about how the majority of Aboriginals live in Australia is hidden from the view of the rest of the world, and to an extent, our own population. Communities such as Utopia, Northern Territory, do not have the living conditions that are consistent with a healthy lifestyle. The social determinants of health that come into fruition regarding this issue are the social gradient: stress, early life, social exclusion, unemployment, addiction, food, and even transport. Displaying the Defying Empire exhibit. This exhibit is a collection of Aboriginal art echoing a united theme of the unfair nature of the empire, or in modern vocabularies, the government. There was a piece that stood out from the rest on a personal level for me. And this was the artwork entitled Double Standards. This piece is an assembly of 216 Japanese rice paper boxes that are placed in a like box. The juxtaposition of using another culture's artwork to highlight Australia's cultural gap between Aboriginals and Anglo-Saxon Australians is powerful. When first looking upon the piece, one is allured by a bright, colourful Australian flag. However, when each box is examined closely, there are images that define a high social gradient between Aboriginals and white Australians. There is also a blank boxes scattered throughout the piece, perhaps to incite the viewer into thinking that there were gaps in history that were possibly a result of atrocities not worthy of official record or even anecdotal record. It is clear a gradient exists in Australia. This is exemplified with remote Aboriginal communities and indeed Aboriginals that live in urbanised towns and cities. This gap clearly links to the health outcomes of Aboriginals living throughout Australia. It is further emphasised by the other social determinants of health, leading to premature death or morbidities. The Australian Bureau of Statistics posted that the average age of an Aboriginal male is 69.1 years and females 73.7 years, as opposed to Australians in general, which have an average age of 80.3 years for males and 84.4 years for females. This basic statistic is the outward effect of ill health in Aboriginals and clearly demonstrates an inequality. Klammer, Dugin and Barry discuss how, in one survey, 90% of Aboriginal Australians experienced racism. It was also found that racism is associated with increased psychological distress, alcohol and drug use in young people, young Aboriginal people. Furthermore, interpersonal racism was linked to depression in Aboriginals from the Northern Territory. Racism is multifaceted and complex. The aspects of racism can be direct and indirect in terms of health. Direct impacts can be racially motivated violence, where an impact to health is immediate. Indirect effects are part of a more complex social construct. This construct runs from unfair access to medical, social, and economic resources that are required for good health. Through the lens of an Aboriginal person, life and history are intertwined through experiences of the individual, but also the collective Aboriginal culture. This collectivist culture has been subjected to what amounts to the worst kind of racism, although there is much good to be sought. Some of the members of Aboriginal communities are employed and even pay their taxes to the government. This is always living in squalor, in tin sheds with a single tap for water, no electricity or sanitation. The juxtaposition of a group of people which some pay their dues to the government and in turn receive no community benefits whatsoever is shocking and is a hidden secret that Australians are not privy to. The appalling conditions are affecting many elements of Aboriginal culture at a fundamental level and need to be addressed through systemic change. The removal of Aboriginal infants from families is a common occurrence to this day. The motives of integrating Aboriginals into Anglo society are no longer apparent. However, the policies of the current day means that it is still an occurrence. Policies still exist that allow for the removal of children from their birth parents, albeit these policies are designed to protect infants that are born into a family that cannot provide what is deemed to be a good life. Furthermore, looking at the health of Aboriginals, babies, and pregnancy outcomes for mothers, there are increases in maternal and fetal morbidity or mortality. The effects of stress that can be generational trauma from the stolen generation itself are not actually clear. Whether these are direct or indirect from other lifestyle factors is still uncertain. This all said, the effects of stress on women during pregnancy has been shown to be a determinant of maternal well-being, pregnancy outcomes, and the early life of the child. The World Health Organization describes early life as a social determinant of health, and that early life lays the foundations for health into adulthood, and these foundations begin even before birth. Hence why preterm health is paramount. Aboriginal women are not set up for success in pregnancy, and from the beginning, this links to every determinant of health, inclusive of stress, social gradient, social support, addiction, food, transport, social exclusion, just to name the significant determinants. Moving now to reflect on the intervention. The intervention was a result of the Little Children Are Sacred report, which originated from the Northern Territory Government Board of Inquiry into the protection of Aboriginal children from sexual abuse. The Australian Federal Government used this report to initiate the Northern Territory emergency response, a key aspect of which was the effect or partial suspension of the Racial Discrimination Act 1975 and several others. The very fact the government suspended the Racial Discrimination Statute of Law instantly breathes an air of abrupt racism, when the very law that was designed to protect Australians from racism is no longer applicable to the authorities that are sworn to uphold said law. Issues arose. The number of cases of law enforcement officers abusing their powers is significant in areas where large Aboriginal communities are present, particularly in remote areas immune from media scrutiny and higher command direct intervention. Cases that gained media traction, such as the case of the death of Mr. Cameron Doomadgee at the hands of Christopher Hurley, is an exemplar. Mr. Jumanji was killed in custody with horrific wounds, which included a ruptured portal vein, which is a major vessel connected to the liver. This incident was well publicised. However, after court proceedings, Hurley was not convicted. Given the nature of these events, the accurate reporting of all instances cannot be attained. However, the question of the number of incidences of police brutality and unlawful detaining or the use of unnecessary force towards Aboriginals is one that is incredibly hard to answer. In reflecting that law enforcement are the authority figure that is deemed to protect us, it is also apparent that nurses and doctors are too in a position of power. If there is an interaction with the person in a position of power through the lens of an Aboriginal whose culture has endured what it has, is there always going to be a positive interaction? The therapeutic relationship for healthcare workers is central to care, and if cultural barriers persist, how do we as healthcare workers help? Perhaps it's through education and empathy. To quote the University of Canberra Elder in Residence, Auntie Ros, "We are all people, and all cultures are important. Elders hoping for change, who may be set in their ways, need youth to motivate and influence change." This is a unique view that is not commonly seen through the white Australian lens. Aboriginal leaders or elders are keen to move forward from the atrocities and acknowledge that their culture has good and bad, and that there is scope for reconciliation within Australia. Particularly about what I spoke to before, generational trauma is incredibly acute when there are removals of children and grandparents or past generations that were privy to direct trauma often overreact at an unprecedented level. And it's important to reflect on this if, as a healthcare professional, we are involved in such an. Albeit, moving forward, that there were significant works done in the way of the apology, there is more work to be done. Racism needs to be surgically removed from key positional entities, which in some cases are very well hidden. To see that an individual such as the UC Elder, one of the era of the stolen generation, can speak words of such hope after the traumas that she endured shows a level of holistic resilience that far outreaches any that I have seen in my short life. As I spoke to before, healthcare professionals are in a position of power, with an authority gradient when engaging with patients. This is further increased when cultures differ, such as an Anglo-Australian treating an Aboriginal. It is important to consider that the fact that as healthcare professionals we're at the front line of treatment and see Aboriginals in vulnerable positions. This means that it is important that we practice cultural competence within our scopes. Furthermore, it is important that we as healthcare professionals advocate for Aboriginals in society and strive to stem stigma surrounding Aboriginal people. Sharing the good is far more important than precipitating the negative images that are connected with Aboriginal people. To conclude, visiting the Defying Empire exhibit was a very powerful experience and brought up questions regarding the treatment of Aboriginals currently and throughout history. The research that was undertaken shed light on a past full of horrors and viewed current policies that are not fair or empowering. However, it is proved that there are initiatives that can help begin the healing process, and that there are leaders in the Aboriginal community ready to move forward. It is also safe to say that as a registered nurse, I will advocate for these people as much as I can throughout my practice and indeed my career.